Next. Yeah. Next, we have Dr. SREEKUTTY, ANAND, talking on visual acuity and complications after cataract surgery in diabetic and non-diabetic patients.
Good morning. This is a topic on a comparative study of visual outcome and complications following cataract surgery in diabetic and non-diabetic patients. The aim of the study is to compare the visual outcome and complications after small incision cataract surgery in diabetes and non-diabetic patients. Materials and methods, study design. It's a comparative study of 1 year duration with the study population of two groups. Group 1 with patients undergoing small incision cataract surgery with diabetes mellitus and 2 without diabetes mellitus. Inclusion criteria: the patients undergoing small incision cataract surgery between the age of 40 and 80 years, and we excluded traumatic cataract, complicated cataract, posterior segment cause for visual losses, secondary glaucoma, neovascularization of the iris. And the sample size were 174 eyes calculated from a previous study by Soumya, and it included 87 eyes in diabetic and non-diabetic group. And the sampling method used was convenient sampling. Methodology and data collection. Preoperative visual acuity, anterior and posterior segment findings were noticed, and after cataract surgery, they were followed up with visual acuity, slit lamp and fundus examination on postoperative day 1, 7 and day 30. And the data was tabulated after converting Snellen's vision to logMAR values and was analyzed by SPSS software. And if the p-value is less than 0.05, then the result is considered to be statistically significant. And the results: 174 eyes were studied, of which 87 eyes in each group, and the mean age of the study population was 66 plus or minus 7 years, with slightly lower in diabetic group. And best corrected visual acuity in logMAR in the preoperative period showed no statistically significant difference with a p-value of more than 0.05, and after the surgery on postoperative day 1, 7 and after 1 month after the cataract surgery, it showed a statistically significant difference in these groups, with poorer visual outcome in the diabetic group. And the most common type of cataract seen in both the groups were nuclear sclerosis, followed by posterior subcapsular cataract. And the early complications noticed in postoperative day 1 were corneal edema and anterior chamber fibrinous reaction, which were more common in the diabetic group with the p-value of less than 0.05. And after 1 week, majority of these complications were resolved, and only corneal edema persisted in 6 patients in the diabetic group, while it completely resolved in non-diabetic group with a p-value of 0.003. And late complications, that's after 1 month, posterior capsular opacification and the macular edema were seen more significantly in diabetic group with a p-value of less than 0.05. And the mean age of cataract were lower in diabetic group in this study, similar to a study by Fleischer et al. And Framingham eye study. And the type of cataract seen in this study is nuclear sclerosis, which is the most common one. And in Blue Mountain eye study, it showed cortical cataract, and Kesseltropak and Tekin et al. Showed posterior subcapsular cataract as the most common one. And the final visual outcome was poorer in the diabetic group in this study, and a multicentric database study by Chancellor et al. And Kelkar and Mehta et al. And in the study by Soumya showed no significant difference in outcome in both these groups. And the early complications like anterior chamber fibrinous reaction were more common in this study, similar to a study by Ivancic et al. And the corneal edema were more common in diabetic group in this study, similar to a study by Soumya. And the late complications like PCO formation were more common in this study and study by Ivancic, Ebihar and Kato et al. And Hayashi. And the macular edema was common in this study, just like this study conducted by Ivancic et al. Conclusion: the mean age was lower in diabetic group. Nuclear sclerosis was the commonest type in both the groups. Visual outcome was significantly lower in diabetic group, and the early postoperative period showed higher incidence of anterior chamber fibrinous reaction and corneal edema in the diabetic group, whereas in late postoperative period showed macular edema and posterior capsular opacification more in diabetic group. Thank you.
Any reason for having this PCO more in diabetic groups?
More inflammatory reactions. inflammatory cascades mediators are more common, more in diabetic group.
In diabetic also, they have, in non-diabetic also, they have developed some PCO.
If the migration of the lens epithelial cells is also the cause for PCO formation.